Well, now that the American Health Care Act is in the hands of the Senate, a work group is putting all their effort into making sure the bill will work for the American people. One America's John Hines caught up with a member of that group and has more from Capitol Hill.
Hello, I'm here with Senator Mike Lee of Utah. And Senator, I know you're a member of the Senators Work Group. You've been chosen by, I believe, Leader McConnell to participate in a work group in the Senate with regard to health care, developing the Senate health care plan. You've written an opinion piece saying you're a conservative and some of the changes you'd like to see in Obamacare. Could you talk about those, sir?
Sure. First and foremost, I want to see prices going down. I want to see the price of health care and health insurance going down. Obamacare has made those worse. We'll get it better by repealing Obamacare and replacing it with free market reforms.
And I know that one of the reforms that you want to see is with regard to the Medicaid expansion. This is one of the things that conservatives have been concerned about with Obamacare. Talk about what you want to see and the changes with regard to the Medicaid piece of this plan.
In order to make it sustainable, we need the per capita growth rate to increase by no more than CPI-U, which is the Consumer Price Index urban measure. That, I think, would make it sustainable. What's in the bill now, which includes measures that are above what's called CPI-M or CPI medical, would make it unsustainable.
And I know that you talk about in your piece that you wrote some of the requirements that Obamacare has with states with regard to some people are required to have insurance they maybe don't need. Talk about some of those changes that you'd like to see potentially in a Senate bill.
At the heart of Obamacare, at the heart of what made everything more expensive in health care because of Obamacare, are a series of requirements governing things like the essential health benefits, the community rating, and other regulatory requirements that tell the insurance industry that they can only offer a certain type of health insurance, that type of health insurance that Congress in its infinite wisdom deemed adequate. That's exactly what has made health insurance so unaffordable. We need to get rid of those, and we need to return the power to the states to decide how insurance is going to be regulated in each state. That would do more to make health insurance and health care more affordable than any other single thing we could do.
So potentially the Senate bill would give a lot more flexibility to the states to pick and choose what sort of things they want to offer in a health care plan. Is that kind of
Yes. And the beauty of this is what the Constitution already requires. There's nothing in the Constitution that tells us that we've got the power to regulate health insurance comprehensively. This not being an enumerated power of Congress, it needs to rest with the people and the states. And that's where it ought to be. It would also have the incremental advantage of making health care cheaper.
Well, that would come from Our Lost Constitution, a book that you happen to, so you're intimately familiar with the Constitution. And sir, I just wanted to ask you, you're meeting regularly, is this weekly or bi-weekly, the meeting of the Senate Working Group?
We've been meeting at least twice a week. We also have other discussions with the Senate Republican Conference as a whole, more times a week than I can count.
Is there a sense of when you might have some kind of a final product, a draft bill or something or some talking points or something like that?
I wish we were to that point yet. It's going to be at least weeks. It could be months before we have a finished product, but we are determined to repeal Obamacare, and that's why we're working so hard.
It sounds like a process, and you're just working the process to see what you guys can do.
Exactly.
Very good. Well, there you have it. Senator Mike Lee, a member of the Working Group on Health Care here in the U.S. Senate, talking about health care, and back to you all in the studio.